Hey, how you doing? This took from Medical. Just a product demonstration day. Okay, so go from hand, the finger model. Okay, this is the finger dislocation simulator to practice reduction technique, relocation technique. Okay, so middle finger is the most common finger to have a dislocated finger. Okay, and also this PIP joint is the most common joint. Okay. So this one, you can dislocate like this so, okay? And my model, you have to use actual traction, okay? You have to push or pull or whatever you need. So usually what I do, finger dislocation, I uh, put like this so, and say the kids, okay, look the other way, and then I do in front of me, okay? So what I do is push the end and use the other hand to hold the tip, push with this thumb, and then pull with this hand, but also a little extension. And if you'll do that, snap, okay? Push and pull, and if you can hear it, little snap, okay? So that's how you reduce it, okay? And you can do dorsal, okay, okay, and also volar, which is this way, okay, okay. You can do both on this model. All three models I have at this moment is all tension adjustable, so you can make it easier, harder, any way you want. People ask all the time, is the tension realistic? Like, depends, okay? The sooner reduce, I mean, the longer it's dislocated, and it's gonna be harder to reduce, okay? And I get a comment on YouTube, videos that, okay, the mine didn't go in like that. I need they had to have three people to put it back together. Well, I mean, he went to the emergency room. It takes about 4 or 5 hours after, you get admitted, and it takes 4 or 5 hours to see it. Then back, if it takes that long, it's gonna be harder, okay? So this was the finger one, okay? Again, push and pull, then in, okay? So elbow model, okay? So you can dislocate, okay? Posterior dislocation, okay? I've seen these many because the jiu-jitsu is very popular now in the US, and a lot of people practice, which is good. But some people didn't know when to stop, and then they don't stop and they get dislocation. Okay. So a couple different techniques. One is face down technique. Patient is on the exam table, and then I think this is the exam table. It's just a table, but okay. And then little extension, and then pull down. Okay. You really have to use actual traction pull. Okay, you think I'm pretending it, I'm not. I mean, there's a tension system here, so you really have to use actual traction. I'm not pretending it's hard. You have to really use it. So this is the model to, how to position yourself, where you need to stand, what position, and how to apply traction, and also how fast you need to apply traction. So I can tell you this one. So this elbow model, you can just pull down fast. You can on this model because nobody's gonna sue you. You can do that to this model, and it will be fine. However, would you do that to actual patient? You will not. Okay. So what would you do is basically, so you get to this position, right? Face down technique, and then you pull down a little bit. Hold it, let me see. Okay, and then you pull down, right? Your traction. Oh no, it doesn't go. And you put more and more and more and more, gradually, and then eventually it's gonna go in. Okay, you're not gonna just pull down fast. No, we don't do that. Okay. All right. people ask all the time also, what about nerve damage? Okay, my doctor say, you know, this could be a nerve damage, so don't reduce it. So my question here is, so if you notice nerve damage, you're not going to reduce it? I mean, you got to reduce no matter what eventually, right? I mean, unless you suspect, you know, fracture, yes, then yes, stop right there. But, you know, you do a test, you know, like ask the patient to squeeze my finger, great. Can you put the palm up and down? Great. And then you feel the bone, right? Palpation, and then make sure it's solid. If this part is cracked, okay? If this part is cracked, then you can reduce it because it's not gonna stay in there. So it's a surgical case, so that's why just you palpate, right? If it's mushy, it's moving, it's like, nah. But if it's solid, it's a judgment call. You know, if you want to do it, do it. If you don't want to do it, don't do it. You know, nobody's going to judge you. Okay, it's a call. But let's say if I made a call, I'm going to reduce. And then, but if there's a nerve damage, I'll say, okay, when you dislocate it and there's it causes nerve damage. Could be temporary, could be permanent, I don't know. Okay, but it's damaged. And you need to have documentation, okay, or use the technology, you know, record a conversation, and then go from there. Okay, if they say they don't want to do it, then don't do it. Send it to the emergency room. Okay, it's their call. Okay. Safwat Alabasi, how are you? Thank you for thumbs. You know, so elbow dislocation. Okay, so another technique could be patient on the ground. Okay, I do it here. Think about this, the ground. Stretch your arm, put the body weights on it, and then traction up. Okay, so that's cool. You know, that's the technique, you know, you can use. Another one could be, you know, patients is on, let's say, on the bench already and sitting down, and then you notice could be elbow dislocation, and then you talk to them and say, yes, please reduce, then use the back side of the bench and then push against to it and then reduce. Okay, so this is the thing, which technique is the best? My opinion, whatever works. Okay, because the technique I can use, it doesn't mean you can use it, because you might be 100-pound healthcare provider, then you have to deal with 300-pound football player, and then, you know, it's the technique I use, I like, but the technique is not really working for you. Okay, so you have to find your own technique. It works. Okay, and there's a people, they doing the research, you know, they're trying to find which technique is the best. I think they're looking for something it doesn't exist. Be honest with you. I mean, my opinion. I mean, it doesn't fit for everybody. Okay, so this is my first creation, my baby, the shoulder dislocation model. So this is the left shoulder model with the camera is opposite. But this is the left shoulder model. That's the only side we have. And it's dislocated. Okay. So this is a technique I teach now at the class workshop. So I use my elbow and the hip and squeeze patient's forearm. Okay. And they kind of wrap around mine. Okay. So make as a one piece. Your body and patient's arm is a one piece. All right. And then from patient's arm is kind of this position right now. So you want to move it to 90, okay? From here to 90. How are you going to do that? You're going to shift your weight to the side, okay? You're here, right? And you're going to shift your weight to side. Oh, sorry. And shift your weight to the side, okay? And then traction. Then this time you put your weight to the back. Shift your weight to the back, okay? And if you do that, okay, and a little extra rotation if you can, and then you can chip clock. Again, shift your weight, and then extra rotation and traction, but also shift your weight to the back. Okay, so the technique I just showed you, there's no, I mean, I didn't see anywhere on the, Google search. I just, I learned from University of Michigan sports medicine staff member. She's like 5'2", 3", 110 pound. And, she showed me this technique. I never thought about it because I'm not in this situation, because I'm 5'9", 190, 95, or maybe 200 right now. But so I didn't think about that kind of technique, but that technique, it works because you make your body and patient's arm as one piece, and then shift your weight. This is a great technique. So again, there's nothing search, I can tell you. I just named it. Okay, I should have named her name, put her name as a technique, but I didn't get her name. So anyway, that's the technique I use to teach right now. Okay, so any questions? So Techline Trauma is my official distributor. I do not sell my product anymore directly. Just if you can send an email, but I will forward it to my distributor, so they can help you. If you want to purchase the model. I offer workshop. So if you're interested in having one, 15 people minimum, at least 15. One class is about 25 people. That's the cap. I mean, I do pop-up presentation about 40 minutes, and then I go to hands-on part, and I can do PowerPoint presentation with 2,000 people, but once I get to the hands-on, it's gonna be waiting game, which I don't want to do that. So that's why my cap is 25. So if you're interested, let me know. Of course, it's with the cost. It's cost. So I usually just charge, and then plus if there's a overnight stay if I need to. Okay. The one place they did was basically they fly me out on the flight for the day, and then get there. I did a workshop, 2 sessions, and then afternoon, get an airplane, come back. Okay, so you have to, pay the airfare, and if there's a long ride from the airport to the location, I might charge the transportation, but that's pretty much it. So, any questions? Anything you want to see? If it's not, then I'll be done. Hopefully you guys having a great Saturday. Is Saturday? Yeah, Saturday. So have a great weekend. If you have a Monday off, that's 3 days weekend. That's nice. So all right, see ya.